Okay, I'd like to welcome you to the 8th Annual Maryland Conference on Problem Gambling. We are very pleased with the quality of the program and the speakers, and also pleased with the turnout, over 900 registrants. So Zoom does have some advantages. Many thanks to everyone that has made the Center on Problem Gambling such a success over the last 10 years, starting with our sponsors at the Behavioral Health Administration, Dr. Aaliyah Jones, Kathy Rebert Franklin, Mary Vigiani, and Laura Burns Hefner. And also to our friends here at the University of Maryland Department of Psychiatry, our chair, Dr. Jill Rockbeisel, our medical director, Dr. Chris Welsh, and the director of the Addiction Division, Dr. Eric Weintraub. And finally, to all of the dedicated staff at the center, and in particular to Donna Gaspar, who has led our efforts for this conference and has done a great job. I'm going to take a minute to introduce our program director, Mary Drexler. She's the director for the Maryland Center of Excellence on Problem Gambling, University of Maryland School of Medicine. She brings over 38 years of experience. She was previously with the Maryland Lottery and Gaming Control Agency. She managed the voluntary exclusion program. And she was also executive director of the Connecticut Council on Problem Gambling for 10 years. And most importantly, over the last year, she's brought her staff through the COVID wilderness safely to the Harbor of Hope, then also through the Valley of Cicadas, past the fear of isolation, past the curse of Zoom fatigue, and safely to the promised land of herd immunity. So let's give it up for our program director, Mary Drexler.
Thank you, Rob, for that introduction. Welcome, everyone. I'm excited today, as Rob had mentioned, that we had over 900 attendees registered for this conference. I want to thank you all for taking the time to join us, for helping the center to bring further awareness to gambling disorder as an addiction, because working together, we are able to mitigate the harm faced by individuals and families with the addiction in communities all over the state of Maryland. As many of you know, sports betting legislation recently passed, opening up more opportunity to participate in gambling activity. And with this, it also opens it up to others who may begin gambling based on the ease of access, especially with online access coming our way with sports betting. Ensuring responsible gambling practices are in place as sports betting rolls out is essential. The other things we're working on in collaboration with our partners is that we continue to educate our courts and our legal system on how to assist in our efforts to help people get connected to treatment, especially our most vulnerable populations. It is now more than ever the time to be having that conversation regarding potential risks of engaging in gambling activity within our families, and I say right now, especially with our youth. Before I introduce our next speaker, there are just a few points I would like to share. And the first one is I need to do a thank you to all the center staff who worked tirelessly to put together this conference. I personally am proud of our team here at the center and their commitment to providing quality services to anyone who is struggling with gambling addiction. And then I would like to remind all attendees that during our breaks and during lunch, you will have access to what we call the discussion board, where you'll be able to network with one another, and you'll be able to access the virtual exhibitors and the poster session. We will have our staff involved with the discussion board should you have any additional questions. I want you to please be sure to take this opportunity to visit that. It is now my pleasure and my honor to introduce Kathleen Rebert Franklin. Kathleen is currently the Director of System Access and Practice Innovation Division in the Maryland Department of Health, Behavioral Health Administration. The focus of the division is to design and to implement strategies to enhance consumer access to services and to improve quality of care. Her responsibilities include problem gambling services, suicide prevention, workforce development, expanding peer support specialists into emergency departments and other settings, peer supports and navigation services for families, public awareness messaging, screening, brief intervention, and referral to treatment in hospital emergency departments, and implementing medications for addiction treatment in primary care and hospital settings. Her past managerial experience as the chief of the Baltimore County Bureau of Substance Use and her clinical training at Sinai Hospital with individuals with both substance use and mental disorders have really provided her with the foundation for her current work. Please join me in welcoming Ms. Kathleen Revert Franklin.
Thank you for that wonderful introduction, Mary. I appreciate all the work that you and your team do, and I'm grateful for your involvement with this conference and for allowing so many participants to be here today. So if you go to the next slide, I want to just start with doing some level setting. Gambling is widely viewed as a socially acceptable form of recreation, and for a majority of individuals, it is a harmless activity, but for some, it can become addictive and carry severe negative consequences. The terminology can be confusing with the inclusion of gambling disorders in the DSM-5. However, the term gambling disorder is the most current term for one who meets the diagnostic criteria. According to the latest systematic review, problem gambling is a significant problem in the United States, and not just for adults. It's estimated that 6 to 9% of young people and young adults experience problems related to gambling. And studies show untreated gambling disorder can lead to financial, emotional, social, occupational, and physical harm, and may also be a relapse risk factor. There are effective interventions, and those with gambling disorders can and do recover. Next slide. So the data on problem gambling shows through a survey of Maryland households. We conducted the survey between August and October 2017 to assess changes in gambling prevalence in the Maryland population following the introduction of casino gambling in 2010. The goal was to obtain updated information about gambling behavior among Marylanders, particularly disordered gambling behavior, and compare 2017 data results from the baseline evaluation carried out in 2010. The survey showed that most adults gamble, even if with only lottery tickets. Internet gambling is particularly problematic. Those who gamble via the internet spend more than twice the amount of money as compared to other types of gambling. 3.4% of adults in Maryland have a gambling problem. A new prevalence study will be released in the next month or so, and we are widely anticipating its results to show updates, especially around the impact of COVID. Next slide. So the next two slides present data on the prevalence of mental health and substance use disorders among those with a gambling disorder. This information identifies that this is an undetected problem in clinical settings. The data show the need for programs to set policies and procedures regarding screening all clients for a gambling problem. As you can see, there is a significant link between gambling disorders and depression. People struggling with gambling disorders are almost 2.5 times more likely to attempt suicide than the general population. And nearly 50% of people struggling with a gambling disorder have thoughts of suicide. Next slide. Like depression, there's a strong link between gambling disorders and substance use disorders. Studies have shown that 40% of those in substance use disorder treatment meet the DSM-5 criteria for gambling disorder, and their length of stay was impacted, it was reduced. So screening for problem gambling at the time of admission could affect that person's treatment outcomes. Next slide. And to just touch for a moment on some data specific to veterans, the impact of gambling disorders is even more devastating. The study showed that 64% of veterans who attempted suicide identified that gambling problems were a contributing factor. In addition, data retrieved from the Veterans Administration confirmed that there's a strong connection between veterans with a problem gambling disorder and suicide ideations and attempts. Next slide. And next slide. Legislation was created in 2007, which established the Problem Gambling Fund and the required uses of the fund, prevalence studies, 24-hour hotline, and treatment services, as well as the mechanisms for funding those services. Next slide. Fees assessed on the casino are determined by the number of video lottery terminals and table games used at each casino. An estimate of the amount to be collected from the casino is made at the beginning of the fiscal year and is reconciled at the end of the fiscal year. Because of COVID, casinos reduced the number of video lottery terminals and table games, resulting in a reduction of funds in FY20 and FY21. Next slide. So what do the funds pay for? Although the funds pay for treatment services, we realize that we need to push out other kinds of services in an attempt towards maximizing prevention and early intervention. So we're providing family peer support for loved ones, for those with a problem with gambling. We're providing funding for public awareness activities and providing a robust training package for clinicians and programs. The Maryland Center of Excellence on Problem Gambling is our partner in implementing prevention and early intervention activities. Next slide. But first, let me talk about treatment. One of the purposes of the Gambling Fund is to eliminate barriers to treatment. Free treatment is available to anyone, including those with medical assistance or other insurance coverage. A variety of provider types can provide free treatment and be reimbursed by the Maryland Administrative Services Organization. Providers that are not Medicaid providers can still access this account by contacting the Maryland Center of Excellence for assistance with completing an application. Private practitioners and community-based providers must ensure, however, that staff are trained and competent to provide services to individuals with gambling problems. The Maryland Center of Excellence on Problem Gambling is available to provide free problem gambling training and clinical consultation to your program. Next slide. Free mental health treatment is also available to the family member or loved one of the person with a gambling problem. Also, as previously mentioned, family peer support is available for families or loved ones concerned about someone's gambling. This service can help the loved one cope and find support for themselves and potentially for their loved one. Next slide. The partnership with University of Maryland is critical to the success of problem gambling initiatives. Through their 2 departments in the School of Medicine, we expanded services beyond what is legislatively required. The center provides content knowledge expertise for the field and beyond. Next slide. The clinical division of the Center of Excellence is responsible for the provision of 24-hour helpline, as well as peer support for individuals with problem gambling concerns. When an individual calls a helpline, they can be connected to a peer at that time. This helps engage the individual and increase their linkage to services. They also provide community outreach and prevention activities, education, public awareness activities, and training for behavioral health providers. Next slide. The research division of the Center of Excellence, their role is to conduct prevalence studies and other studies that provide insight into actions BHA should be taking. Next slide. For example, a longitudinal community-based study showed a higher prevalence, severity, and occurrence of symptoms of gambling disorder among people with mental health and substance use disorders. Because of these findings, we push for increased screening for high-risk individuals, such as those with a mental health or substance use disorder. In addition, we are increasing public awareness of gambling problems, co-occurring mental health and substance use issues, and their potential interactions. A current study is underway looking at the effects of the COVID-19 pandemic on problem gambling behavior. Next slide. March is Problem Gambling Awareness Month, and many people with gambling disorders go undetected due to the lack of awareness by the general public and the lack of training in symptom recognition by clinicians. Based on the research findings on comorbidity of gambling disorders, substance use, and mental health disorders, BHA worked collaboratively with center staff to engage behavioral health providers across the state to participate in National Problem Screening Day, which was on March 9th, and hopefully many of you participated in that. This was to raise awareness around Problem Gambling Awareness Month goals and initiatives. We had radio and TV public service announcements. that were targeted to the public regarding problem gambling and the resources available through the Problem Gambling Helpline. The theme was, if you think gambling is a solution, it may be the problem. Ads started March 15th and ran for over a month. We have an ad to play for you, and is that available to be pulled up?
If you or a loved one is gambling as a way to escape problems, it may be time to rethink. Because if you think that gambling is the solution, then maybe it's the problem. Problem gambling is an addiction, but there is help available. It's free, confidential, and it works. All you have to do is reach out. Maryland offers free help. Just call or text 1-800-GAMBLER. That's 1-800-426-2537.
Thank you. That was an audio ad. We also had ads that were digital as well as PSAs. Okay, next slide. So our efforts were designed to provide information as well as drive viewers to listeners to where they could get more information, such as the helpline and the website. As you can see, helpline call volume significantly increased, as did website traffic. These services provide support to those seeking answers for themselves or their loved ones. Next slide. This is a list of resources that are available to you and your colleagues in your programs. It is the Office of Problem Gambling that we have at the Behavioral Health Administration, and Laura Burns Hefner and Latrice Jackson operate that. The Maryland Center of Excellence on Problem Gambling, of course, is available for many purposes, so we encourage you to reach out to them with any questions you have. And then the Maryland Coalition of Families operates our Family Peer Support Program, and that is their contact information with any questions. Thank you very much, and I hope you have a wonderful conference.
Found online sports betting. That was my entry in, $20 bet on a meaningless college basketball game, and I was hooked from there. Started, with the smaller bets, and, I remember being up, bet on a game at midnight, and I'm up sick to my stomach watching this game. And, I just remember that rush, that feeling that I got, but that feeling was just unbelievable. I mean, when I'm playing, it was just a rush and going through it. Started making larger bets, and, it built to a point where I was just doing this around the clock.
If you or a friend has a gambling problem, call the free confidential helpline, 1-800-GAMBLER.
Congress can regulate sports gambling directly, but if it elects not to do so, each state is free to act on its own. That is a line from the 2018 Supreme Court ruling that struck down the Professional and Amateur Sports Protection Act, PASPA. After that ruling, it was crystal clear that states can pass their own laws to legalize sports betting. And as of today, almost half of all states have passed some sort of sports betting legislation, with bills still being heard in many others. Sports betting is generally considered innocuous, but as we saw in that video, it can have devastating effects on people's lives. That's why it's important that any sports betting legislation include provisions that support responsible gambling efforts. Here to talk about that, we have a panel of 4 experts in the field. Brianne Dora Schwal, Vice President of United States Policy and Strategic Development for Epic Risk Management, will discuss what we are seeing internationally. And then narrowing the focus a bit, Patrick Willard, the Director of Policy and Advocacy for the National Council on Problem Gambling, will discuss state-level regulation. And Brian Hess, Executive Director of the Sports Fans Coalition, will discuss consumer rights. Before we narrow our focus to Maryland, where Jim Logue, the Managing Director of Gaming for the Maryland Lottery and Gaming Control Agency, will provide some insight into the regulations that are currently being drafted in Maryland. This panel will very much be a conversation. I know I have questions for these guests, but please leave your own questions in the Q&A box because we'll have ample time to discuss all questions later on in the session. So first, I'm going to let all 4 panelists just kind of go without me interrupting them, and we'll start with Brianne.
Good morning. Thank you so much for having me here today. I'm really excited to share with you all my perspective on sports wagering. I have the incredible privilege of serving as Vice President for U.S. Policy and Strategic Development for Epic Risk Management. Epic does work in 23 countries across the globe, working to help prevent and mitigate and reduce the harm that can come from gambling for so many individuals. And as I begin my work here in the U.S., talking with policymakers, both at the legislative, regulatory, and local levels about the implications of legalized gambling, I think that it's really prudent that we talk a lot about what's happening in the international sector. There are nations that have had sports wagering for quite some time. And there are some real important lessons or things that we need to be looking at that have gone awry. And I pulled some examples today to hopefully set the stage for some good, robust discussions. And the first thing I want to point out is that the UK is undergoing tremendous scrutiny right now, particularly around sports wagering and legalized gambling, as just recently it was identified that advertising served as a motivator for 1/3 of British gamblers. And there really weren't any stringent, requirements or restrictions on advertising and where it was being done and how often. And so really it's something that the US needs to be thinking about. As Blair pointed out, we've now got 32 jurisdictions here in the US with legalized gambling, if we count DC and Puerto Rico. Patrick's going to speak more to this. But we've seen only a few of them even talk about the implications of advertising when they've gone ahead and legalized sports wagering. And why is this so significant for us to think about? Well, when we look at the UK and we look at the few regulations that exist, and we know that advertising is a powerful tool, it's really important to highlight that we've also know that 55,000 children in the UK have a gambling disorder, and another 300,000 adults are actively struggling. So what is it? Is it just the advertising? Is it the access? What else? And so, we can look at some other countries that are also really wondering about what's going on. What kind of rules and regulations need to be in place to keep consumers safe? And we don't have to look any further than Spain as well. They really created some waves in the international community recently when they banned football sponsorships, or as we call here, soccer sponsorships from gambling operators. It wasn't uncommon for the majority of soccer shirts to have a gambling logo on them. And there was a tremendous amount of concern that this was negatively influencing and impacting children. And so not only did they ban these sponsorships, they took it a step further and said that there would be no gambling ads on radio and TV, except for the hours between 1 and 5 a.m. And while I absolutely applaud these efforts, it also really begs the question about why the advertising between 1 and 5 a.m. is still okay. Because while, yes, we aren't in front of children, I also worry about who is watching TV between 1 and 5 a.m. and what are their relationships with gambling, and if maybe we're inadvertently also enabling adults who are struggling with a gambling disorder to kind of have an inundation of ads. So a little bit more to be desired there and teased out in Spain, but still thought it was important for everyone to know. Promotional bonuses, something that you may be seeing very soon here in Maryland. I'm in Virginia and see them quite often. With the, inboarding of legalized gambling come lots of promotional ads. It's all about customer acquisition, and these operators will use enticements to get players over to their product. And preliminary research that we're seeing over in Spain and the UK is showing that that comes with tremendous risk and tremendous consequences. And so what is that balance between customer acquisition and promotional products with consumer safety? We've also seen recently in the news in jurisdictions like New York and New Jersey, something called FOBTs, fixed odd betting terminals. This primarily involves racing. And, there was tremendous backlash in the UK not that long ago that individuals were allowed to place £100 every 20 seconds bets in these FOBTs. And they found that that was really contributing to tremendous increase in prevalence in gambling addiction. And so yet they moved the max bets down to £2. And we are not seeing anything like that here in the US. In fact, it's left very open. Instead of putting restrictions, we're seeing, okay, here's a new introduction of FOBTs, and really leaving it at that. So something for everyone to be cognizant of. And then it's not just Europe, everyone, it's also Australia. Australia was really one of the first mature markets in the sports wagering world to really examine this utilization of cashless and the implications for gambling addiction prevalence. And Australia was one of the first that did have restrictions, not only on advertisements, but the ability to bet with credit cards or with money that you didn't otherwise have. And now the UK decided to follow in suit with Australia and actually took it one step further, where they ended up not only banning the utilization of credit cards, but also payment through e-wallets that are able to be funded with credit cards. We aren't seeing anything of the sort here in the US. In fact, just today, it was announced for the first time that there is actually the first ever casino that is 100% cashless opening its doors in Vegas. And cashless is the way of the future here in the US as far as we're seeing. And so it's really important that we talk about all of the risks that come with that, but also the opportunities that come with that, because cashless does provide us better access to data, information, consumer protections, and the ability to communicate. And these are all things that I hope in the next hour or so of this panel that we can talk about to empower you and Maryland with information about what's coming, what may be further down the road, what other nations and states have seen that have been doing this for a little while, and how to create that safe and sustainable market in Maryland. So thank you again so much for having me here today. I'm really looking forward to a robust discussion with my fellow panelists. It's an honor, and I think we're over to you, Patrick.
Great, thanks, Brianne. So I'm going to zero in a little bit on where we are in terms of the U.S. And it's useful to know that, in the U.S., if we could back up, there we go. Nope, go to the map. So in the U.S., you can see what we've got right now. Let's talk about the weather. You can see that they're on the East Coast, that it seems to be getting hot. Back to the map. Nope, back to the map. Yeah, there we go. See the East Coast, it's getting hot there, and Maryland's right in the middle of it. Looks like there's a warm front moving in. Meanwhile, down south, it looks like it's a little chilly in the deep south, although along the Gulf Coast, there seem to be some warm trends moving in. In the middle of the country, it seems to be pretty cool, although some hot spots are developing in the mountain states and in the Northwest. And meanwhile, of course, off the coast and out of the continental US, it's still very cold out there. So that's the state of the weather right now, and you can see that's where we are. Maryland has now joined most of the eastern seaboard states in terms of adopting sports betting. Sports betting, it's important to note, has only been around now for 3 years. And yet we're seeing, as Brianne mentioned, 32 jurisdictions that have adopted sports betting. In addition, Maine has passed it in the legislature. We'll see if the governor decides to sign that bill, and that would put us to 33 states across the country in just 3 years moving into sports betting. And while this map may look like it's just a choice between sports betting and non-sports betting, it's actually much more of a patchwork out there. What we're seeing is states adopting different tax rates, adopting different sets of regulations, adopting different rules around responsible gambling, and also making changes in terms of the funding that they're putting out there for problem gambling services. So that you would, just in this past year, what we have seen is that those states like Maryland that had a referendum in the 2020 election have gone ahead and passed sports betting legislation. So Maryland, Louisiana, Nebraska, South Dakota all had those referendums. But there are differences there as well. In South Dakota, sports betting is only going to be going on in the city of Deadwood. In Nebraska, you're only going to be able to do your online betting if you're around the casinos. In Maryland, you have a much broader sports betting network that's going on, and the same is going to be true in Louisiana. The other thing that we've seen in 2021 is that governors have reached agreements with tribal nations to do new sports betting compacts or new gambling compacts that allow those tribal nations which are operating casinos in Arizona, Connecticut, and Florida to get into the sports betting world and thereby change the nature of sports betting that's going to be going on there, so that you will have online betting now in Arizona and Florida. And in addition, what we're seeing in those states is it's less clear what is going to be done in terms of additional funding for problem gambling. Much of what was going on before relied upon the tribal nations to make contributions to problem gambling services. In Florida, under the legislation that was passed this year, that funding was kept exactly the same. In Arizona, all of the authority was given to the Gaming Commission. And in fact, the tax rate that are going to be paid is still not known and will be made as a decision from the Gaming Commission. So there's a lot of authority there. In Connecticut, which has had a long-term relationship with the tribes there for the casinos, there will be an additional $1.5 million that'll be going into problem gambling services this year. And so again, this is what we're seeing is a patchwork that is going on across the country, and it's likely to continue. We're going to see referendums coming up, we know, in the next election. California has already put a referendum on the ballot for 2022. It looks like Georgia and Alabama may follow suit. Legislation in those two states was put off this year, but it looks like they might be looking at going with a referendum in the future. Texas, which was considered a big prize, is probably not going to be looking at this again until 2024 because they only meet once every other year. And then we're still waiting to see what happens in the legislative sessions in Massachusetts and Ohio. Both of those are looking at sports betting legislation. Ohio is hoping to vote on it by the end of this month. We'll see if that actually happens. So that's the sports betting landscape that we're seeing out there around us. But as I mentioned, there is another piece of this that's not just about having sports betting. It's also about, is it mobile or is it not mobile? And so let's go to the next slide. what you can see there is that there has been a focus on internet gambling and what is going to be the result of that. Internet gambling has resulted in states have gone to it because they wanted to get additional funding for their budgets. Generally, this is what's moved sports betting around the country, states looking for additional funding. But what we found is that actually sports betting is not a money maker for states in the same way lotteries are. In fact, in some cases, lotteries are 20 times more, bring in 20 times more revenue than sports betting. And yet there's this mindset that the country is an open market right now for sports betting, and that states should jump into this to try and increase their funding. And as the industry pursues this, they're pushing the internet gaming piece of it as well, as a way to increase the revenue collections. But by putting it online, by making it so that you can do your mobile betting, you're actually increasing the market, which is something the industry wants, increasing the market for people to participate in gambling. And if we increase the market, then there are obviously going to be an increasing number of people that would have problems with gambling. And we need to prepare ourselves for that. So next slide. And what we've seen is that that actually is what is happening. So in Michigan, which just this year began the work of going to adopting internet gambling in January, they had a spike in their helpline calls. People that had not been participating before suddenly were participating in internet gambling, so you ended up seeing more people calling in, expressing concerns about problems in the month after the online gambling became available. And so I think we need to prepare ourselves for that in terms of looking at what's going to happen in Maryland as we get ready for the adoption of sports betting, and thinking about how this and other elements of internet and online gambling are going to play into it. Which brings me to the last slide, which is, during the debate in Maryland, I think we saw a lot of conversation on Zoom, always on Zoom, and a lot of testimony that was put out there around the sports betting bill. But if you look at the testimony, and if you look at the people that were coming in, it was very heavily influenced by the gambling industry, by those people that were interested in being operators, by the sports leagues and the teams. You had the Orioles testifying, you had the Titans, or you had the Ravens testifying, and you had professional sports associations participating. You didn't hear as much from the people who were treating problem gamblers. And you didn't hear as much from people who were concerned about this. There was some testimony. The center filed some testimony around this. But in the end, the legislation didn't really make any changes in terms of fundamental funding for problem gambling services. The only addition was to say that unclaimed winnings from sports betting would go to the problem gambling fund. We don't know how much that would bring in. There's no estimate of that. And the legislations that have passed this year, when they took up mobile betting or sports betting, other states did go ahead and make an additional contribution. In New York, they went to online betting and added $6 million for problem gambling services. In Nebraska, they put a total of about $1.2 million set aside for problem gambling. Connecticut is going to get an additional $1.5 million for problem gambling services going forward. Even in Wyoming, the cowboy state, that little state which has a population that's less than Washington, D.C., they put $300,000 aside for problem gambling services. And that would rank pretty well compared to what some other states are doing per capita. So, other states have looked at sports betting, and when they've made the decision about sports betting, have seen that this is a different animal and is something that they need to think about in terms of how they're going to address it going forward. One place where there was additional funding in the Maryland bill was for the centers at Bowie State and Morgan State to study analytics and sports gaming. That will be useful in terms of helping everyone in Maryland understand what's going on in terms of the numbers and the data around sports gaming, in addition to the work that's being done by the Center of Excellence and the research that it's doing through its surveys. So my point here is that whenever there is legislation that deals with gambling, the people that provide the services, the people that treat problem gamblers should step up and be heard. Even if it doesn't result in additional funding, it is important for us to raise awareness about the issue of problem gambling in every one of these settings so that lawmakers, so that the policymakers and the decision makers can understand that that is part of the equation of what they are trying to do. It's not just money for the state. It's not just money for operators. It's not just winnings for players. It's also, what do we do to take care of those people who have problems and have behavioral health problems that we need to address? So at the end of the day, I think that we're going to see a lot more legislation around sports betting in Maryland and across the country. People are looking at esports and other issues. I think there's opportunities based on the research that we're going to be getting to make decisions around some things that Brian mentioned, like what's happening with cashless, how are we making payments in terms of wagers around sports betting, and also the technology that's involved in sports betting and how to do a better job of providing responsible gambling opportunities and protecting consumers. Because at the end of the day, I think that's what our role is here, is to make sure consumers are protected. And I think there's no better person to talk about that than Brian. And so I'll turn it over to you, Brian.
Thanks, Patrick. We heard some great world news from Brianne, and Patrick gave us a wonderful weather report. So I guess that makes me your sports anchor today. So I'm Brian Hess. I'm the Executive Director of Sports Fans Coalition. We're the largest nationwide nonprofit dedicated to sports consumer issues. These include things like sports betting, but also equal pay for women athletes, tickets resale reform, public financing of sports stadiums, sports blackouts. You know, we cover a wide gamut of policy areas. But the Sports Bettors Bill of Rights, if you want to go to the next slide for me here, started as an initiative from Sports Fans Coalition 3 years ago, right after PASPA was repealed. In 2018, you can hit the next slide as well, sorry. Right after it was repealed, the states, we saw a free-for-all, right? With tons of states were introducing legislation, New Jersey, one of the first. And I sat back and realized, like, there's something not right here. Yes, we should legalize it. There's a really dangerous black market. We legalize it. There is a potential for revenues for states. You know, how much is up for debate, but there's still some revenue available, and people already do it. So we might as well legitimize it. But we also know that sports betting is can be a very dangerous activity for people, especially those who are more prone towards problem gambling disorders. And so I wanted to approach it from a consumer-oriented perspective. How do we create a legitimate market, avoid a lot of the pitfalls that we've seen in Australia or the UK, and create something actually safe and worthwhile in the US, especially as a way to incentivize people to leave the black market and come over to the legitimate market. So we created what's on the next slide here, what we call the Sports Bettors Bill of Rights. You can go ahead and change slides. We boiled it down to 5 rights: the right to integrity and transparency, the right to data privacy and security, the right to self-exclusion, the right to protection of the vulnerable, and the right to recourse. Go ahead, next slide for me, please. So we start with integrity and transparency. And how we got to these 5 rights is we held a symposium shortly after the repeal of the Supreme Court, in which experts from the law field, public advocates, including actually Brianne here on our panel. She sat in as a representative, and even Attorney General Brian Frost was a speaker. And we debated this idea. We debated between industry experts over what should protections and rights be. And at Sports Fans Coalition, these 5 rights. And the first, like I said, is integrity and transparency. We believe that sports betting is only as good as the consumer's faith in the market. And that integrity and transparency are the #1 motivators to get people to leave offshore booking and come to the US and use it within our states. And this also means that bettors should have total and equal access to all necessary information they need to make a bet. This includes, the odds, but also some of the data used to support those odds, as well as knowing when payouts happen, how do they get their money, what are the policies and procedures, the terms and conditions, make that clear and obvious to the average consumer. Next slide, please. Second is data privacy and security, especially in the world of mobile online betting. Our data is out there. We all know that. So we want to make sure that all operators are using the top-notch, best security possible, because we are concerned about financial information here. But we also don't believe that these operators should be allowed to share our personal identifiable data or even our marketing data to third parties. I make the one example of why should an operator go tell a sports merchandising company that my favorite team to bet on are the Washington Nationals, right? Why? They shouldn't get to know that information. That just makes it more dangerous as you start having this confluence of advertising. Next slide, please. Self-exclusion, we've already talked about this a little bit today, and most people here probably know what that is, but self-exclusion protects bettors. It's a pillar of all kinds of regulations across the state. And we believe that a good self-exclusion list should allow self-limitation as well. So not just saying, don't let me bet, but also limiting my bet sizes, limiting my frequencies, all let me choose to do that. And we believe this is one of the most powerful things that we can give fans, which is the power to regulate themselves. Next slide, please. Protection of the vulnerable. This is where we talk about minimum age. In Maryland and Virginia, that minimum age is 21. And we think that's a good age because we do see a lot of problems with college students who are starting to bet, especially if you're allowed to in your state bet on your college team, which is another completely different issue. We do think that 21 is a more appropriate age for that. But this also talks about creating the proper resources for addiction and treatment. This is why we also advocate for at very least 1% of gaming revenue generated by a state being dedicated to a problem gambling relief fund of some kind. And actually in Virginia, which we'll talk about in a second, does 2.3%. Go ahead, next slide. So recourse is the last one. The top line, if you take away one thing from this slide, is you should not be required to go into forced arbitration. We believe that if there is a problem, if you believe you've been a victim of fraud, or you believe that the operator has cheated you in any way, you should always have your right to sue. And we believe that that's the best way to empower fans to push back against these big operators who have far more money than they do, obviously, and allow them to seek the kinds of recourse that they need. Next. I believe that actually might be, yeah, next slide, please. One back. There we go. So there are 3 states right now that provide the entire Bill of Rights. Most states who have passed sports betting have some of the rights that we advocate for, but Virginia, Maryland, and DC are the 3 major ones that have done the entire Bill of Rights. Virginia in particular has an entire section in their code just called the Sports Bettors Bill of Rights. DC and Maryland have all the same protections and language, but it's more sparsed out throughout the bills. So it might be a little harder to search that command find. But we focus on the DMV largely because I'm based here in Arlington, Virginia, and we have a lot of connections in Maryland, DC, and relationships from being a more local organization. Even though we do advocate for these things in states like California, Arizona, Michigan, and so we do want to expand this, and we think states should look at this model to approach sports betting from a consumer and personal angle. Is something that only 3 states have done. Most get lost in the dollar signs and trying to find what revenues are on the table for them, especially as budgets are falling short because of the pandemic. But we really think that the only way you can capitalize on that potential revenue is by approaching this from a consumer standpoint first. And so we would encourage that, we hope this will spread through all of the other states. You can go ahead and hit the next slide. Thank you so much. I will look at the questions and answer any that I can, and I will now turn it over to Jim.
Okay, thank you, Brian. Let me start off just by saying that I've been attending these conferences for the last several years, and they're always interesting, very informative. So congratulations to the team that puts this all together. I think they do just a wonderful job. So new legislation this year, legalizing sports wagering in Maryland. I'm just going to give you a very high level explanation of a couple things that were in the bill, and then we'll get into what it might look like for responsible gambling when we get into our regulations from the Maryland Lottery and Gaming. So in Maryland, you will be able to wager on professional sports, college sports, Olympics, esports, motor racing, award events, or competitions if they are authorized by the commission. And in some cases, horse racing will be available at some of the sports wagering venues. It does not include high school sports, or it does not include fantasy sports. So they developed different license classifications for sports books in Maryland. There are Class A, 1 and 2 licenses, there are Class B, 1 and 2 licenses, and there are mobile licenses available. The Class A's and B's are all physical locations. They're brick and mortar sports books. There's a possibility of 47 of those locations. 17 of them have already been identified in the bill. So there's 17 locations that, as long as their applications are accepted, they will be able to have sports wagering. And then there's 30 that are open for anyone to submit an application for. There's 60 possible mobile licenses, and mobile licenses are not tethered to a sports book. So let's say a casino gets a sports book in their facility. That doesn't mean they're going to have mobile as well. They have to apply for that separately. The bill created a new commission. It's called the Sports Wagering and Application Revenue Commission, or what we're calling SWARC. And they are actually responsible for reviewing and approving the applications that are coming from the licensees. One of the big questions we're getting now is a timeline. When's this going to start? When are we going to be able to face off first wagers? And to be honest, I can't give you that answer. And really, I don't think anybody can at this point. There's a lot of work that still needs to be done. The SWARC committee, they just had their first 2 members appointed yesterday, and they still have 4 to go. And then they all have to be approved. So they haven't even started their work yet. So it's going to take them a while to get off the ground and start working. And it's still going to take the lottery a while to get our regulations and whatnot prepared for the first opening. So where does responsible gambling fit in as it relates to sports wagering? Well, let me read you an excerpt from the bill, which says, except as otherwise provided in this subtitle, the commission shall regulate sports wagering and the conduct of sports wagering to the same extent that the commission regulates the operation of video lottery terminals and table games. So in other words, they expect us to come up with regulations that are very similar, if not the same, as what we already have for existing casinos. So currently, right now, Maryland Lottery and Gaming, we are in the process of writing those regulations. They are not complete yet. We hope to have them complete within the next month or so. Once they're done, they have to go before our commission and be approved. Once they are approved, then they will be out in the public for anybody to see. I can't tell you exactly what they're going to look like, but I can tell you that they will closely mirror what you see today in the gaming regulations for casinos. So let's go over a few of those regulations. Current regulations require licensees to develop a responsible gambling plan that shall include at least the following elements: goals, procedures, and deadlines for implementation of the plan, identify the personnel responsible for implementation, identify the responsibilities of those personnel, training for personnel on problem gambling and voluntary exclusions. And I'm not going to get into the voluntary exclusion program right now. You will hear this afternoon from Maryland Lottery and Gaming's Director of Problem Gambling, which is Jasmine Countess. She is the expert on VEPs, and she can answer any questions you might have about that program. But of course, the VEP program, we want to make sure that that information is kept highly confidential. So these sports wagering locations are going to have to give us explanations on how they're going to keep that information confidential. The plan also requires to identify the means of educating players about problem gambling treatment resources, treatment and prevention programs, and the voluntary exclusion program. It must address the placement of responsible gambling awareness materials. It must include plans to ensure that an individual in the voluntary exclusion program is not permitted to enter a facility, to place wagers, or to claim any jackpots. It must identify their response to the discovery of an individual who was enrolled in voluntary exclusion program on property or attempting to place a wager. And then the old catch-all, any other element required by the commission. They're also required to submit an annual report which describes their responsible gambling plan. That way we can review their reports, make sure they're keeping those up to date. So what are the licensee's requirements as they pertain to responsible gambling? Well, they're required to post signage that prominently bears the gambling assistance message and the underage warning message. They must include the gambling assistance message on any advertisement that is intended to encourage play. They must also ensure that a printed advertisement bears the gambling assistance message, that a billboard bears the gambling assistance message, that a radio, television, or video advertisement bears the gambling assistance message, that the gambling assistance message is printed on paper product that is associated with player consumption or food or beverage if the product is special ordered and branded with the licensee's logo. They must ensure that gambling assistance message is printed on ticket stock. They must place in the facility responsible gambling awareness materials according to their responsible gambling plan. A sports wager may not be accepted in any way by the use of a credit card or an electronic transfer of funds from a credit card. Now, in addition to Maryland Lottery and Gaming's voluntary exclusion programs, one benefit of mobile operators is that mobile operators can allow for players to set their own gaming limits, such as deposit limits. A player will be able to set daily, weekly, monthly limits on the amount deposited into their account. They can place wagering limits on how much money they wish to wager while they're playing. And they can set time limits so that players can control the amount of time that they want to play. You can also exclude yourself from these mobile operators. You can exclude yourself for days, weeks, months, or even years. But if you exclude yourself from a mobile operator, you are only excluding yourself from that particular mobile operator, not all the operators in the state of Maryland. We've heard some talk before from some of the other speakers about funding and treatment for the prevention programs. Currently, there is a problem gambling fund in the Maryland Department of Health, primarily provided funding for problem gambling treatment and prevention programs. Expenditures are made by the Department of Health and have been used to establish a 24-hour hotline, to provide counseling and other support services, to establish an outreach program, and to provide free problem gambling treatment and prevention programs. I think it was Patrick that touched on the funding for that program, but there was an annual fee of $425 for each video lottery terminal operated by Maryland's 6 casinos during the year, and an annual fee of $500 for each table game. Patrick also mentioned that in this bill, the only additional funding that was provided for in this bill was that any winning wager on a sporting event that is not claimed by a winner within 182 days after the wager is won shall be distributed to the problem gambling fund. Now, I don't imagine that's going to add any kind of windfall to the program. So it looks like for right now, we're going to have to depend on the current $425 for VLTs and $500 for the table games. So I'll leave you with this. Obviously, this is a work in progress. We still have a long way to go. And I want to thank you for your attention, and I hope to be able to answer any questions you may have. Thank you.
Thank you so much to all of our presenters. I'm like trying to keep up with the questions and there's so many, I love it. At this time, can we have all of the panel members turn on their audio and video, and we'll start going through some of the questions. I'm seeing a lot around advertising. So I think that might be a good place to start. So I'm seeing as an avid Philadelphia sports fan, seeing ads and sometimes explanation of sporting odds during pregame programming. Will the public be bombarded with commercial advertisements on public television and cable channels? So would love to hear from the panelists what you've already been seeing, what the expectations are around advertising, and things that we would like to see in the future around advertising.
So I'll
Well,
start off
go ahead,
and
Patrick.
I'll just start off on that. And, I think that obviously, from Virginia opening their gambling over the past year, I think we've seen the type of ads we're going to be seeing, which is ads that are going to be, offering $1 down and you're going to win $600. And that type of advertising is going to be part of what Maryland's going to be facing here going forward. I don't think we're going to see what I've seen in states across the country is very limited restrictions on advertising by the states. They will try to suggest that they should not be targeted towards minors, and they will suggest that they should not be misleading. But there's very little that the states are going to be able to do to try and limit that. And Brianne, I don't know what your experience is on the international side.
Sure. Well, I'd just like to go off on the national first. We saw Puerto Rico with their regulations probably have the most aggressive by way of advertising restrictions or parameters, I'll say. But, preliminary research shows that we've seen an increase in the more mature markets, and even in some of these markets for the last 3 years, go up 1,300%. So back to my original and my first quote, this is quite concerning because we know that advertising really does dictate and drive gambling beliefs and participation. So with an increase as much as 1,300%, this is quite jarring. Not only that, it's just a matter of it may not be geared towards children. Again, to echo Patrick, we are seeing that kind of standard language, but sometimes it's just about that normalization. For so long we had thought with the legalization of sports wagering, we would see those odds and those recommendations on alternative broadcasts. And now actually what we're finding, given the hands-off approach to regulations and legislation in this domain, is that the alternative broadcast is the one without the odds or the inclination to talk about gambling. So, I would also be remiss to not talk about the partnerships we're seeing. The joining of gambling operators with very large broadcasters. This has implications as well for advertising. So,
and the other thing that I'd like to see more of, and I did not predict the onslaught of ads that came in Virginia once Virginia legalized. I mean, every time I turn on any of my streaming apps, it's just sports betting ads all the time. Is more prominent, please game responsibly. Think about every, drink alcohol ad that we have. You always have to say, please drink responsibly, right? And it's prominently in text. We need to be encouraging that kind of advertising as well. And having, if you think you have a problem, call the hotline. Here's the number in big block text, not, tiny fine print, or not said like a pharmaceutical ad listing off side effects. Right. And these are the kinds of things that, on a state by state level is going to be really hard to do. This is where we need a federal approach, something out of the FTC perhaps, or even the FCC if we're just talking over public airwaves, that can actually regulate the kinds of advertising in the way that is advertised to the public.
Yeah, I'd just like to comment too. I'm glad Brian brought that up about the federal regulation, because Gambling is a state's right, and that's why it's different in every jurisdiction, and they all have different requirements. And like Patrick mentioned, when there was testimony before the bill, before the legislature, all you saw down there were gambling interests. You didn't really see much of the responsible gambling interests being able to testify. So it's a state's right. The difficulty is the map that Patrick put up. You see, we're surrounded by other jurisdictions that have sports betting. So if we put too many restrictions on advertising here in Maryland, we're putting our sports betting venues at a disadvantage, at a competitive disadvantage. And so there's a lot of pressure not to do that. So right now, as I stated, we have a lot of requirements around the problem gambling message being on all types of advertising, whether it be TV, radio, or printed material. But like Brian said, I mean, you can't watch a sports game without constantly being bombarded with these ads. And then even in the background in the stadiums, you see the billboards in the back with, because they all have associations with these, sports wagering platforms. So, yeah, I don't know what the solution is, but I mean, it's not going to be easy.
When we're talking also about ads not being targeted towards minors, or even on, like to Brian's point about Europe saying how they 1 to 5 a.m. is when you can advertise. When I went to the Nationals game on Father's Day, I'm sitting up in my seats with my dad, and around me are all kinds of children. And here we have on the Jumbotron, MGM and all of the DraftKings and, all of these advertisements about outfield, right? We know there are going to be children at the ballpark. Like, this is a family event. It's always been a family event. And why are we allowing big, prominent, targeted ads like that in those ballparks when we know there are children there is another, concern that I have, even as a fan.
Honestly, I think to mirror both what Brian's saying and what Jim's saying, this is why I was so impressed to see Maryland file a piece of legislation that was going to require gambling education within the school systems. Because to Jim's point, yes, it would be a disadvantage to the businesses in Maryland to do heavy restrictions on advertising when you've got DC and Virginia flooding the airwaves, both radio, print, TV. But what we can do is be aggressive about prevention and education, and starting our children from a young age talking about how gambling has become normalized in society, particularly around sports, which is a pastime enjoyed by many Americans, right? So how is it that they're supposed to handle this? Just like we talked to them about alcohol, which Blair, I'm sorry to steal, I think I saw as one of the questions, right? But the way we talk to them about alcohol, drugs, sex, this needs to become part of our approach and curriculum for gambling and sports wagering. And so, I'm going to give kudos to Maryland. I guess that didn't make it as far as we all would have liked, but as I travel across the country, and I think, Patrick, you're probably in the same boat, we get asked more than that. Give me the gold standard. Who is it? And I am so happy to say, Maryland did this. You should too. Just bring it on home and let's set the new standard. So just food for thought about what Brian and Jim said, and an option as I see it.
Thank you all. One more clarifying advertising question, and then we'll go on to another topic. Someone had asked, did advertising look different before, pre and post COVID?
I think it was different based on states that we had states that just started. Michigan just started at the end of COVID. We had, Virginia just started. Nevada, I think, was probably doing the same things that they were doing before. Clearly we saw a spike in helpline calls, after we got to the fall of 2020. But because, sports was shut down, casinos were shut down, all that sort of stuff. So, so there wasn't any advertising at that point.
During COVID, when we saw the spike in obscure sports, right? Table tennis,
yeah.
So those states that had legalized gambling, yes, sure, they were still advertising, but now that, sporting events have returned, I think we're only going to see an explosion.
Thank you. Jim, can you clarify or maybe repeat, sports bettors will not be able to use credit cards? Is that what you had said earlier?
Yes, that's correct. We won't allow them, like I said, the regulations haven't been finalized, but I don't suspect that will be removed. So they will not be able to use a credit card to fund their player's account or make any transfers from a credit card.
Thank you. That's so wonderful. So another question, as it relates to online gambling, how can it be ensured that the person gambling is not a child? Yeah, does anybody know how the different platforms are able to confirm that?
KYC, know your customer.
Yep.
But I don't want, I think Jim, I saw came off mute, so I'll turn it over to him. But it's a great question and an important topic when we talk about policy.
Yeah, and I don't know all the ins and outs of that, but all of these mobile providers, they have know your customer. They have companies that's all they do is know your customer. So you have to provide certain information, identifying information, and they have multitude of databases where they can go check that material and verify that material that you've provided to make sure you are who you say you are. So obviously, I'm sure it's not 100% foolproof. I mean, if a child knows, all their parents' private information, credit card numbers, expiration dates and all that stuff, I mean, it could happen. I'm sure it's happened, but they do a lot of work to make sure that they know exactly who they're dealing with.
So if I may, KYC is really important, in this age of free to play and these games that look and feel and simulate gambling but may not actually be gambling. We're seeing KYC only happen after a child has engaged when it comes time for payout. So by this, I mean, there are plenty of games where you can play for free and then there might be a prize at the end. And that's when they're running these KYC features to say, oh, actually, you're not of legal age. Sorry, you're not going to get it. But at that point, it's a little too late, right? So really, it's about running KYC features at the first onset of engagement of play. That's something we work closely with operators across the world about best practices and policy. And really, KYC in its best form is also going to run against your self-exclusion lists. Patrick and I travel across the country talking about the need for self-exclusion. And this is one of those things. It's not just about age verification. It's making sure the products aren't getting in hands of folks that say, you know what, I need help and I shouldn't be playing. Good self-exclusion, good KYC, they do intersect with one another, which is why we struggle when states like Pennsylvania have 4 different lists. It's overly cumbersome. Streamlining is really key, and that's the reason why.
Thank you. Still having trouble keeping up with the questions. I love this, everybody. Let's talk about funding. I'm seeing some questions about that. First of all, will the money taken in by the state through sports betting be put back into education?
Yes. So there's a specific education account that all the money that goes to the state, that's where that money will go to.
Thank you.
My
And then
understanding is that was part of the referendum process, and I do think that as we deal with these states that do referendums, where in the referendum they specifically say where the money's going, it is creating some problems in terms of saying, well, a certain percentage of that should actually end up going for problem gambling services as well. Just 1%, 2% of that money should go there. But the complications are the voters voted. They voted to do the blueprint for Maryland's future fund, and that's where the money should go. And so that's one of the complications that we have in some of these referendums.
Yeah,
absolutely. And I think that one thing that will be really beneficial is down the line being able to see the impact that sports betting has on problem gambling, and especially being able to get demographic information could be really helpful in going back to the Maryland legislature and trying to get an increase in funding. So before that might be able to happen though, are there other funding sources that it may be a possibility to increase the funding for problem gambling in Maryland?
Well, I mean, I think that it's one of the things that we've seen in other states is, which Maryland doesn't have, is tribes are making contributions to problem gambling funds. I think as the industry itself can make contributions to the problem gambling fund and as part of its own role. I do think that we're better off though having legislative language that takes a dedicated, committed portion of revenues and sets it aside for these purposes over the long haul. I think to some of the points that Jim has made, it's possible that the legislature may come back and decide, because other states are allowing credit cards, that Maryland might need to think about looking at credit cards. If legislation starts moving like that, people that are in this webinar ought to jump on it immediately and say, that money, if you're going to do that, you need to make sure that more funding is going for problem gambling, because this is only going to make the situation worse. And so, there are all sorts of little elements that are different between the states. The tax rates, Maryland's got 15%. That's, probably right in the middle right now. But if, other states go lower, legislatures might want to change that. The licensing fees, you got pretty big licensing fees here. So there's a possibility people will address that. There are all these little touch points that the legislature might want to get into in a couple of years just to correct things. The industry might want to correct things. And that's the time to hit the ground and start saying, okay, but if you're going to do that, we need to make some changes about how much funding is going for problem gambling.
And what's interesting when you compare Maryland to Virginia on this, when we were advocating for an increase of dedicated funding from sports betting for the Maryland Problem Gambling Fund, we were told that the fund that currently exists is underutilized, that there is a surplus of funds. And, no matter how many times we said, yeah, but you're creating more bettors, you're creating more people who are going to be at risk. You should be, increasing this account accordingly. They still said, the account's not utilized. And there are some restrictions as to how those account funds can be used. Virginia had no casinos, had no previous gambling industry. And so when they come at it, they're coming from a fund of $0. And so they decided we're going to squirt extra funds in this, and they put it at 2.3%, almost double what we actually, as the advocates here, asked for. Yeah. So, you see a brand new market coming in and saying we need to catch up. So we're going to put in a lot more funds, and that can always be taken down later, through legislation. Let's, fingers crossed, hope not. But we had a more experienced market decide that they've had an underutilized source of funds. And so we're not going to put anything extra in until we absolutely have to.
I think that if you benefit from legalized gambling of any form, you have an obligation to be contributing to the fund. So whether you're an industry stakeholder, whether you're a vendor to that industry, whether you're the state, there's really an obligation. I think to Brian's point, we saw that 2.5% in Virginia from sports wagering, but the casinos have to put in 0.8%. Really, I think the question becomes, if there's alternatives, it's really an examination of all those stakeholders in Maryland that need to ensure that they are in some way contributing to this. And as for the restriction, yes, I heard that myself when we were in Maryland, right, Brian? It was quite infuriating.
Yep.
And I think my answer to that was then, and still remains now, that's why these funds need to be created with the purview of research, prevention, treatment, and recovery. Limiting it to treatment sometimes can find, regulators and individuals in the public health sector with their hands tied. And really, there's four main components to this ecosystem, and the fund really needs to exemplify that. So as Patrick said, any conduit to get in and urge for legislative changes, use any bill that you can that has legalized gambling as a way and have your voices heard. It's the time to do it.
It's interesting. I don't know, Brian, you may know this better than me. It was my recollection that the original House bill did have a provision for a contribution for sports gambling, like 1% or something, but for some reason that was taken out. It didn't make it into the final bill. So.
Yep, that's my understanding as well. And even in the Senate version of that, didn't add it back in. The Senate version added in a lot of consumer protections. and then, when it went through its process, but it didn't add in that increased funding.
I'm seeing a lot of questions around education funding, and so if anybody wants to talk more detail about that, they're welcome to. But I kind of am thinking this is probably something that the Department of Education is really the ones who are determining the use of the money that goes in. So I'm not really sure we can answer specific questions about how that money is being used in the school system. Does anyone have anything that they want to add to the use of the funding in schools?
No,
Fingers
you're
crossed,
correct.
teacher salaries.
Yeah,
Yeah, they should.
you're correct, Blair, because when we get that money from the casinos, I mean, literally all we do is transfer it to those education funds, and then how they spend that money is, we have nothing to do with that. It's out of our hands.
Yeah, okay, thank you. There is one comment though that some of the funds go to creating educational workshops to create assemblies to educate children and teenagers on preventing gambling addiction and address other issues. I think that gambling isn't really as involved in the kind of education that we're seeing in schools as much as like drug and alcohol and tobacco and things are, right? And Brianne, I think you were the one who pointed out that there was actually that bill to put a specific put a specific program into the schools that didn't go anywhere. This was the second year that we saw it. We might see it again. I know, it would be great. It would be great. So, okay, I don't want to keep talking though. So do you think when gambling is understood as a destructive long-term addiction that can affect anyone and everyone, then regulations will improve? I really love that question because I think the first part of that is, do the regulators, or not the regulators, but does the General Assembly in Maryland really understand that? Is that something that we talk about enough with them? What do you guys think?
I think as we remove the stigma around problem gambling addiction and make people think of it more along the lines that the society is starting to think of drug and alcohol addiction as a real disease and not just poor character, that we will see better and more regulation. And the reason I say that is, in my course of lobbying on these issues, I remember one conversation I had with a lawmaker who called the Bill of Rights a nanny bill because he saw gambling as a poor character, like, just don't gamble if you can't afford to do it. And it's like, that's not the point. The point is that this is a real mental disorder that we need to address through treatment, not just by punishing people. So I think as soon as society starts to move that way, we will see more reasonable regulations built around science that are evidence-based.
Yeah, and this is one of the things that I think we're focused on at NCPG, the fact that from the national level and from the federal level, there needs to be more attention to this issue. As for sports betting to burst across the country to more than 33 states over the course of just 3 years is lighting a fuse. And since we have this patchwork of state laws around this, there really needs to be a focus on behavioral health and how this is an issue that needs to be addressed as part of the behavioral health system for the country. And that the funding, federal funding, needs to be set aside so that we're actually providing funding for this, just as we are for other addictions, and for the treatment that's needed for that. And in that way, people's understanding and the stigma, I think, will begin to change. Obviously, we've seen the nation embrace gambling. It took from 1974 to 2010 before we got to 40 states to do a lottery, and it's only taken us 3 years to get to 33 states doing sports betting. So people's attitudes have completely changed around gambling itself. Now we need to get people focused on behavioral health and addictions like gambling and how to treat those.
Once we see Health and Human Services and the federal government really start to address this the way they do other addictions, that will be the necessary signal to the states. It doesn't hurt when there's funding coming in for these programs like match grants. Not to seem like the cynic, it did take close to 30 years with tobacco and a very long time with opioids as well. Just given the way that public health is approached here in the US, I think it's going to take a few I don't want to say catastrophes, but I think it's going to take a few incidents in the absence of the federal government really stepping up here for things to start to shift by way of regulations. Right now, it's just about customer acquisition. It's about bottom lines. Everyone's hurting from COVID. Right now, it's not an emphasis on behavioral and mental health. And I mean no disrespect to many of the regulators that I know work very hard for their states and to protect, but at the end of the day, right now, the focus isn't there. And I think we need federal intervention to see it.
Absolutely.
All right, you guys, we have 3 minutes left. I'm so sorry we're not going to get to everyone's questions, but I want to end on one last question, which is, as we're looking out for the Maryland regulations, what are some of the problem gambling safeguards that everybody is hoping to see in those and that might show up in public comment if we don't?
Is this when we get to lobby Jim?
Right.
I mean, I would like to see, you know, a lot of the protections that we have are written in the statute, and to just make sure that when the regulations are published, that they are reflective of the statute and that they strengthen some of the, you know, the desires of the lawmakers and the advocates here, making sure that we can trust every operator in the marketplace, that there is full transparency into who's, you know, especially when we're talking debate over skins and things. I want to know exactly which company is taking my money and which company is paying me my money if I win. You know, that's the kind of stuff that we really want to see. Transparency is the best way to ensure a successful, legitimate market.
Yeah, and
Patrick? Oh, I'm sorry. Go ahead,
make,
Jim.
I will make the comment that these regulations will be published and they will be open to public comment. Exactly how that's going to take place, I don't know. Sometimes they have like meetings just like this, Zoom meetings, where you can give your comments, or sometimes they just solicit written comments, but there will be a comment period on the regulations.
Yeah, and you know, one thing that I would like to see is, in some ways, some flexibility around national events and advertising. As Brian mentioned, you know, when we see these, when the Super Bowl's on and there's a gambling ad on there, and you look at the very bottom of the ad and you can see, okay, there's a bunch of phone numbers down there, but I don't know what that is. There needs to be a way that you can reach out to one number for gambling services. And I think that, you know, we need to think about how states regulate this around national events, because it is, you know, when somebody's at the Super Bowl and watching the Super Bowl and something's going wrong, they need to be able to get that hotline and call it right away. And so I just, that's one area of flexibility I think we'd like to see. I was talking with another gaming commission in another state and just suggesting that there should be the helpline number in advertisements. And there was resistance to that idea because they didn't exactly want to put a helpline number in the regulation. So I'm for flexibility, but I'd like to see us deal with these national issues.
Thank you, guys. Thank you, everyone. This was such a wonderful panel. We're all out of time. But I really enjoyed this, and we're going to be at the Turk conference doing this again, so we hope to see everyone again there.
Thank you, Blair. You did a great job.
Thank you so
Thank you.
much.
Thank you.
Hello, everyone. I am back. I, again, just quickly want to thank the sports betting panel for doing a great presentation. But now we're going to move on. And I want to introduce you and give you some information on the Center's Disordered Gambling Fellowship Program. One of the Center's key deliverables is to plan and implement outreach to treatment providers and other organizations in Maryland by providing them with education and training on how to effectively address problem gambling here in our state. In fiscal year 2020, the center expanded its capability of clinical outreach and training through launching of the Disordered Gambling Fellowship Program. In this program, we have engaged a few clinicians who have demonstrated their commitment to problem gambling and who have worked collaboratively with the center for many years. The center's goal for this program is to enhance the capacity to be able to provide evidence-based training within communities across the state of Maryland. And to execute this next program, we engaged 2 facilitators known for their work both nationally and in Maryland with problem gambling. And I'm going to ask for both Dr. Rugel and Anthony Prenti to join me with their faces on screen here. I see Lori. So, and there is Anthony. So let me do a brief intro. Dr. Lori Rugel is known nationally in the field of problem gambling with 36 years of experience, and that includes treatment, prevention, research, and responsible gambling in all her work. And Anthony is a Maryland mental health professional and addiction specialist with over 38 years of service in the field, who has worked with the center for over the last 9 years. So as they were the facilitators for us for this program, I would like to begin by handing this over to Dr. Rugel, and then after that, have Anthony also talk about what he's been doing with the program. So Lori.
Thanks, Mary. And, you know, it's so much fun to be at the conference. Wish I could be here in person next year. And one of the joys, and it's been the last 2 years, is participating in this fellowship programming and working with mentoring new clinicians wanting to become the new generation of experts in the field. And, you know, what was highlighted in the sports betting presentation was the lack of federal funding. And because there is no federal funding for disordered gambling, we don't have SAMHSA involved. We don't have federal organizations to provide standards of care, standards of training, information out there. So every state has to do this ourselves. It's not embedded in college curriculums like substance use disorder and mental health disorders are. People don't automatically get trained in this. So the center has been excellent in providing the best practices and training for many, many years, since Joanna Franklin did the first trainings in Maryland. But how do we pass on the body of knowledge? How do we mentor new people being able to do training to meet the demands of agencies and organizations who want their staff, want their agencies trained? And we got a lovely group of people who had to fill out an application for this. We just didn't let anybody in. You had to apply, you had to go through a screening process, and they made a commitment to spend, you know, a good chunk of their life becoming more expert, more experienced, and they just didn't sit back and listen. We made them work their butts off, to put it mildly. They had to create presentations, they had to find research, they had to learn how to make PowerPoints, they had to learn how to then transfer, since we started pre-pandemic and doing things in person, they had to learn all the technology on how to do this online and how to create Zoom meetings and how to do this on their own. So they really worked very hard. And I so appreciate the commitment that all our participants made and the effort to learn something new. I don't know about you guys out there, but in this aging brain, learning new stuff isn't any easier. And learning newer and newer stuff. So it's not just learning, okay, now I have to learn sports gambling and sports betting and what that means and what that culture and what that language is about, but then all the technology behind that. And then the intersection of esports and gaming. And then my head's about ready to explode. This is new territory. And our fellows just so willingly engaged in all of this throughout pre-pandemic and into the pandemic when everything else was changing. So just so much gratitude to Center for being on the cutting edge and for our participants wanting to stress themselves out to become the new leaders, the new experts in the field, and learn all this new material and get critiqued in the process. So thank you all very much. And Anthony, my co-mentor and partner in crime for this adventure.
Thank you, Mary, for having us be a part of this very important and, as Lori said, cutting edge program. This is an exciting day, and it's great to be here and be a part of this. And we've only just begun. It's still the first part of the morning here. But I wanted to just say what a joy it has been to work with these folks who have dedicated themselves to problem gambling. And as Lori mentioned, there's a lot of subsets of information and things to learn about gambling, gambling disorder, working with families, working with age populations, teens in problem gambling, sports betting. And they embraced it, and they were committed to this process from the very start. That was so clear, even before they became a part of this fellowship program. It was evident in their applications as we gathered them to come up with a group. And there's been many challenges along the way, personally and professionally, for all of them. And they've risen above and beyond the challenges to stay involved and to continue to learn what they needed to in order to complete this program and to now become a part of the center and what the center offers that is so important to the gamblers, to their families, and to the people who work with gambling disorder. And, you know, we also know that people are working with gambling disorder without even realizing that they are, because there are folks who struggle with this, and it is a hidden addiction. And every clinician, in my opinion, needs to know about gambling disorder, and how it affects recovery, how it affects the lives of others. And these folks have been there all along the way to do what's necessary to become a part of our team. And I know the center is proud to have them as part of the team. It's been a lot of fun. Their intellectual curiosity, I've been so impressed with. They've been, again, so dedicated to the program. They have so much to offer our program at the Center of Excellence, but also to the state of Maryland. So I want to thank them all. It's been a joy to get to know each and every one of them better throughout this process, and I look forward to our continued work together. So my hat is off to them, and I thank them for their service.
Thank you, Lori and Anthony. And I just have to really thank you for being willing to work with us on this new program that we launched in 2020. And obviously want to thank all the participants in the program as well. In a few minutes, we're going to conclude session one and go to a break, but do not leave yet. One of the things I'd like to do is introduce you to the people, because I'm very honored, to the participants in this program. So this next presentation, brief video, will introduce you to all the participants who have been in our fellowship program. So thank you very much again, Anthony and Lori. And before you sign off for your 15-minute break, please engage in watching this final short segment.